Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care, hosted by Dr. Char.
Dr. Mark Heyman, he's a diabetes psychologist. He has his own podcast. He runs a website and he's in private practice. He's an author of a new book that's coming soon. We're going to be talking about that. But he's also a type 1 patient, as well as he's an expert in this mental health field. I'm so impressed. I'm already intrigued. Welcome, sir, to this podcast.
Oh, thank you. And please don't call me sir. Marcus is fine.
Thank you so much. When I went to school for 20 years, 100 years ago, somebody was going to call me Dr. Char. So now you call me Char. But for a year, after 20 years of school.
Yeah, well, I tell you, whenever I've had my PhD for 15 years now or so, and whenever someone called me Dr. Heyman, I think it's my dad. I think he talked about my dad because my dad's a professor and he's Dr. Heyman. I'm like, who's that? Still new to me.
Well, I got married at 16 to this man that I'm still with at 48 years later. And he became Dr. Fry. So after all those years of going to school, Dr. Fry was taken. Every time I tried to write that, somebody wrote me, it was taken. So it didn't just organically hit for me. I made it up, Dr. Char. Now it's
Perfect.
caught on. Now that I don't care if you call me that or not, it's caught on.
Mm-hmm.
But isn't that funny? There's my humility down the tube because somebody was going to. Okay, I'm in Nashville today. Where in the world are you?
I am in San Diego, California.
Oh, it's so pretty there, I bet.
It is.
I love having casual conversations with leaders in the mental health and diabetes world, and I hit the jackpot. I just believe people, at least who I might influence or might listen to me, I think there's so much information now that we're inundated with that if we can have a casual conversation with those that treat us. I just hope trust builds so that then when they see a new book, as intriguing as it's going to be, and I really believe it's going to be, I believe it's going to be almost like a Bible for we in this space. I'm just real pleased that that new book's coming. But in my opinion, it might help people to trust a little better, listen to the methodology a little faster, try it a little quicker. And if that's the case, then my job's done. And so that's why I'm having this casual conversation. So tell us about that journey that you've personally had with type 1. Do you mind doing that?
Not at all. I love talking about this. I was diagnosed with type 1 diabetes just about 23 years ago on June the 1st, 1999. I was in my third year at UCLA, and it was a great year. I had a lot of fun, and I was towards the end of the school year, I was just getting real tired. And, looking back on it, I had all the classic symptoms of diabetes. I was peeing a lot. I was going to the bathroom. I was drinking a lot of water. I was tired. My vision was blurry. But at the time, I kind of wrote that off as that's just me towards finals week, just being exhausted.
Yeah.
The other thing to note, though, is I had been studying French for many, many years, and I had never been to France. And I finally had the opportunity to go to France that summer. And so I was getting ready to go to Paris. I remember going to bookstores and just flipping through books with pictures of France and the food and everything, and nothing was going to get in my way. And then I got sick. And I honestly remember telling myself, you're not sick because you're going to France, and pushing off going to the doctor, pushing off even getting any kind of bad news, because I did not want anything getting in the way of that trip. So finally, on June the 1st, I just couldn't do it anymore. I remember walking to class, and I was walking up a hill, and I couldn't make it. And so I made a detour, went to student health, and long story short, they tested my blood sugar, saw it was over 600, and immediately called the paramedics. And I remember at UCLA, where I was at school, the student health center was on one side of a quad, but there's no car access. And so in order for an ambulance to come in, they had to park across the quad, and they had to wheel me across the quad in a gurney. And I was humiliated. Anyway, went to the hospital, spent a couple hours there. They diagnosed me with type 1 diabetes and let me go home. And they made an appointment for me the next day with an endocrinologist. And I remember, going home and not really knowing what was going on and what this all meant. Went to see the doctor the next day and spent a couple hours with her. She gave me a crash course in diabetes, telling me all about it. And at the end of our conversation, she said, "Do you have any questions for me?" And I remember very vividly saying, "Yeah, I do have one question. I'm planning to go to France in about 2 weeks. I guess I have to cancel my trip." Kind of giving her permission to tell me yes. And she looked at me and she's like, "No, why would you have to cancel your trip?" And 18 days after my diagnosis, I got on a plane and flew to Paris and spent the next 3 months in France. And I looking back on it, it was awesome. And it set me up for success. It was also a little scary because I had no idea what I was doing. I remember one vivid memory that I have is I was low for one of the first times. And I didn't really know what was going on. I didn't really know what I was feeling, but I knew I didn't feel good. I knew I needed sugar. And I didn't have any with me, but I did have some money in my pocket. And there was a soda machine right there. So I go up to the soda machine and I realize I have no idea how to count francs. This is before the euro. It was when they had the franc. And so I'm like just shoving coins into the soda machine, trying to figure out how to get a Coke. So anyway, but I also remember that message, both explicit, but also implicit, that I got from that doctor, is that yes, you have diabetes, but it doesn't have to hold you back. You can leave for France 18 days later on your after diagnosis. You can do whatever you want to do. And I really believe that message that I got from her has set me up for success. And that's the success that I want to make sure that I'm able to set everybody up for, whether they're newly diagnosed and I can talk to them right away, or whether they've had diabetes for 20 years and been telling themselves stories about what diabetes means about them. Helping them to reframe those stories is one of the best parts of my job.
She needs a crown. That is amazing. I was 16 and in Germany. I couldn't speak the language. My husband went off on my husband. That's a whole story in itself when you're married at 17. And my husband was going off on my 17th birthday to training. He was in the military. Mm-hmm. And I couldn't speak the language, and I had understood about my diagnosis was it was very bleak. Now they might have explained that better, but what I heard, it was very bleak. So I spent those first few weeks and months trying to understand it, trying to understand my body, and thinking, would he want to stay if he had known this? Will he come back from the training? Will he show up the next time? All of that, because it felt bleak. So my hat's off to a doctor who said to you without reservation, live your life. That doesn't mean you didn't say already. She gave you a crash course. There's a lot to learn. There's a lot to consider, but giving you a crash course and the nod to go, that is beyond amazing. I like her already.
Yeah, she's an amazing doctor and still in practice. I don't see her anymore because I'm not in Los Angeles anymore. But I think that at that time, 23 years ago, she was a rare breed. I really do, because you hear so many stories, even up to now, where you get lots of doom and gloom. Although I really believe that our endocrinologists right now are trained much better and are much more hopeful, both because their mindset shifted, but also because our treatment methods and our technology has really improved exponentially since then, but over the past 2 years.
Oh,
So.
I totally agree, because you have to remember, I just told you a story from 48 years ago.
Yeah.
If they told me type 1, I don't think I was told type 1. I even wonder now if they even knew. I don't know. I just know they thought it was terrible. That I know, they believed it was terrible. And so, yeah, I do believe that we have great endocrinologists, and I do believe the technology has helped. I mean, sometimes I did a little video that said, if one of my loved ones one more time ask me about my blood sugar, because my little monitor beeps when I go above 160. and it beeps if I go under 70. And so if they recognize the beeps, my husband and son, and I'm like, if one more time. So the technology has gotten good. We're in a good day. We live in a good day. And the best part of my recent days is to see not just a new book that you've written, but a manual that will help those of us, because I went into the mental health field starting as a young woman because of my husband's profession. People asking me, nobody would ask a bank president's wife how to count their money. But in my husband's field, people would ask me questions. And so I started to school. When I finally got to start, I started to school to finish a doctorate because it was a dream of a little girl. And I started in the mental health world to help people with varied needs. As time went on, being type 1 and seeing that the mental health side was left out of that group people for our teams, it's made me want to knock doors down. And I hope I have a few. And I love the fact that I can put a white lab coat on and work down the hall from an endocrinologist, and him just as pleased to have me down there as he is to have another practitioner in the clinical side of that. But what got you started in the professional side of it? We wouldn't have blamed you if you had said, okay, I have this to deal with and I have a career and a life to live. I'm not going to spend my world. Nobody would have blamed you, but it's awesome that you can be type 1 and with experience and professionalism help us in the emotional walk and even in the experiences that are just simply physical and how that all crosses over. How in the world did you decide to go in this field?
So I'm a little bit embarrassed to tell you the story, but I will. So all through college, I thought I wanted to be a lawyer. I have no idea why. I couldn't tell you why. I think I thought I was a good talker and a good arguer. And that's what I thought that's what a lawyer was. But after my diagnosis, I don't think it was my diagnosis that changed my trajectory, but I realized that there are other options out there. And I decided that I wanted to go into psychology. However, psychology grad school, as you know, is competitive. And you have to have a story about what you want to study, why you want to study it, and what you want to do. And I was trying to rack my brain for a good story. I didn't have one. And then it came to me that diabetes was a pretty good story. And so I started doing some research about, what sort of research is out there about diabetes and depression, diabetes and anxiety. And at that time, there wasn't a lot. And I said, I hit the jackpot. This will be my story. This will be my into the field. And then I'll get in and do whatever I want. And it became a self-fulfilling prophecy. I used that story to get in, and then I realized, I think there's something here. And certainly I've taken some detours of my career. I went through training and I got trained. I was a health psychologist I am a health psychologist, but went through a health psychology training program. And then I did some clinical training in the VA system with people with PTSD. And I thought, that's what I want to do. And I went off on that track for a little while. And then eventually I came back to diabetes because I realized it's really where my passion is. It's really where the people that I want to work and the people that I feel like I have the most to offer are people with type 1 diabetes. But I didn't have that vision when I started. To be honest, I used diabetes as a story to get me what I wanted. And I ended up getting exactly what I wanted with diabetes, but not on purpose.
Well, that is one of the best stories when we can take what we thought was just something negative for us, and nobody would choose diabetes. Somebody I heard say it sucks.
I'm not sure who that was.
But the world's going to know. The world's going to know that book. That I'm talking about that new book right now, but it's called Diabetes Sucks and You Can Handle It. That's what's coming.
I have the first copy right here.
Woo woo!
See, it says not for resale, but this is the first printed copy.
And we're gonna talk about that. That's what I believe is going to make a huge difference in our world. But I know for me, my doctorate's in education, and I'm clinically licensed in mental health as a counselor, a couple states. But I say diabetes specific because, yeah, everywhere there's anxiety, fear, all those things that come into play. There's a world of us who, at least as far back as I am, didn't get the privilege of getting help in those areas. And even though now we are better equipped, I have had at least one or two endocrinologists. I don't want to make it sound bigger than it is, but I've had a few endocrinologists look at me and say, I would rather refer to you first, but I don't want my patients to think I think they're crazy. Now that's back in the day, because right now it's vogue to get counseling. In my private practice, I get teenagers just wanting a counselor because they want therapy, because they have friends who have therapy. I mean, it's in vogue, but then it wasn't. And when you are diagnosed with diabetes and nobody's talking about the anxiety, the fear. Yeah, I believe when we finish that book that I'm going to go right into in just a minute, right into it just in a minute. But when we finish that book, it's almost like we've had a few chapters to change a belief. And I'm throwing my methodology in here a little bit too, but we have a few chapters to change our belief. And then that makes us the lead to action, leading by action, sustainable change. Because without that book, without changing some beliefs, the sustainable change just of habits, just of trying, we keep falling off the wagon. Ask me how I know. When there's 200 opportunities to eat in a day, I bet I've taken every one of them some days. And it's not something we can ignore. Right. So let's just jump right in and tell the folks, when's that new book going to be released?
It'll be released on April 19th, 2022.
Next week? What is today? Is that next week already?
It's about a week and a half from now. Today is the 7th of April.
So how exciting. How exciting. Yeah. So where can we find it? Where can we find it first?
Yeah, Amazon's the best place. Amazon, one, because that's the easiest place to get it. You'll get, if you have Prime, you'll get it right away. But also in terms of helping other people with diabetes, the Amazon algorithm does some funny things. And the more people who buy on Amazon and review it on Amazon, so please, if you do buy it, leave a review, the more Amazon will show it to more people like you, so they will really be able to spread the reach of it. You can also go to the diabetespsychologist.com/book, and you'll be able to link to Amazon from there as well.
Okay, for clarity for everybody my age, if you go to Amazon and purchase, the review itself allows it a further reach within Amazon. Yes.
Yeah. Okay. So what the way that Amazon works is they track sales. Of course, Amazon is a search engine for buyers. So, and Amazon wants to sell stuff. So the more people who buy a book or buy a shirt for that matter, the more people Amazon will show it to, because they know people want to buy that thing. And then when you have reviews, Amazon gives the even higher priority and shows it to even more people, because there's social proof that people like it and that it's a valuable thing. So that's why reviews are so important.
That is good. I'm going to ask you a question about it. Tell me what it means to be open to the possibility that you're able to handle this diagnosis. Yeah.
We tell ourselves stories about diabetes all the time, about what diabetes means about us and what we can and can't do with diabetes. But I think that many of us, and I will include myself in this bucket as well, sometimes tell ourselves stories that, if I do this scary thing with diabetes or in my life in general, that I'm not going to be able to handle it. If I ask that person out on a date and they say no, I won't be able to handle it. So I'm not even going to try. If I go for a bike ride and I'm worried my blood sugar is going to go low, I'm not going to be able to handle that, both emotionally or physically. So I won't even try that. And we stop ourselves in our tracks before we even try. But before we talk about actually taking that action, we have to realize that we can handle it, and or even open ourselves to the possibility of handling it may be possible. And so if we're able to do that, and, change the story that I can't handle it to, it may be possible that I can handle it. The possibility is open there. It opens up a whole new world to us in terms of our behavior. It doesn't necessarily change how you feel. You still may be scared. You still may be burnt out. You still may be unmotivated. But if you can open yourself up to the possibility that you can handle those emotions, then it makes them a lot less of a big deal. Because if you're confident, it's like if I went and asked somebody on a date, I remember when I was in high school, I wanted to ask this girl on a date to a dance. And I remember this is back in the day of cord, not rotary dial, but phones with cords. I remember sitting there for 3 hours dialing her number and then hanging up before I finished. And I am looking back on that instance. I think that what I was most scared about or most fearful about was not asking her, but if the possibility that if she said no, which was a very real possibility, that somehow that would be detrimental to me, that I would just collapse, not be able to handle it. And I think back, and if I was confident to know that I could handle that rejection, even though it would suck, even though it hurt, it would make it much easier for me to do that thing. So if we apply that to diabetes, if we're confident that we can handle, the stress, the burnout, the anxiety, the frustration, all those things, and they happen to us, then we're steady on our feet, and it makes it easier to take a step forward and even try. And then by trying, we may surprise ourselves. Actually, we usually do surprise ourselves.
Just opening to the possibility that I can handle it. That is so good, because so many people, I don't have any research other than my own experiences with this. A lot of people, when an endocrinologist refers a patient to a me or a you, they will say, oh, no, I don't want years of therapy. I don't want all this. And what you're doing is teaching somebody a skill. And somebody can say, oh, well, I can learn a skill. I learned to ride a bicycle. I learned, I can learn a skill. That in itself, to just opening up to the possibility is just a little bit of a skill set that you've got steps and ways to do in that book. And whether they ever go outside their own comfort of having the book in hand, that in itself takes away part of the keeping me away from you, because now I don't have to sit in therapy for years. Yeah. Am I old enough till I'm the only one that remembers that? Or is that still an option out there that people kind of neglect that side of the path oftentimes because they don't understand that it's not therapy ongoing, and it can be as simple as a skill?
Yeah, I think sometimes the most effective things that I do in my work one-on-one people is teach them skills, teach them how to handle not only like practical skills, how to check your blood sugar, but also skills about how to handle stress, how to deal with uncomfortable emotions. And I think that I work under a hypothesis that if there were 100 people with type 1 diabetes, that there are in a room, 2 or 3 of them may need to see someone like me or someone like you. And because they're really struggling and they need some more intensive work. Not that other people couldn't benefit, but the 2 or 3 people really, really, really need that. But then we have 97 or 98 people left, and they need something. And what they need is support. They need education, and they need skills. And those things can certainly come from therapy, but therapy is time consuming, therapy is expensive, and there's not many of us out there. So my goal for the book is to be able to give people a resource that they can use to do this on their own. And if they find they can't do it on their own, then therapy is an option. But if they want to learn skills and see what works for them and see what they maybe think, how they may be able to reframe how they're thinking, I think this book is a perfect solution.
I do too. And I'm just thankful that we can literally say in a casual kind of way, we've both done therapy. We believe in it. There's nothing wrong with it. But for those that do not understand that it does not always have to be that thick, but a skill set can be learned. And yeah, that's what spoke to me about opening up the possibility that you'll be able to handle it. That makes it so easy and doable. And I think that's what we need in a world where I don't want anything that takes too long. I don't want to cook because it takes too long. I can drive through a window way faster, and I can pop in a microwave, and I can order food out. And as much as we say, oh, but this other way is still, we're in a fast world. And let's face it, learning a skill set is what we need. And that's awesome. The other thing I want you to address today is honesty is the best policy. You know, there's I don't know why it is, but for type 1s, when you are thicker than you're thinner, it's the best way I know to say it, you get labeled as type 2 more than not. You know, I'm type 1 and been that for a long time. But if you ask me real quick what I weigh, it is so easy for me to say 2 pounds less than that scale said this morning. Yeah. And I count myself a pretty honest person. I mean, my mama says I'm too honest for my own good. But if you ask me too quickly and I haven't thought it through, now why didn't I say 20 pounds less? Because nobody'd believe it? I don't know. But it is easy to not be honest with ourselves. It's an easy thing. It's a comfort thing. And that part of the book is enlightening, it's inspiring, and it's very helpful. Tell us just a tidbit about that.
Yeah, sure. So that's where the diabetes sucks comes in. You know, I know that I've gotten some messages recently from people letting me know they don't like it saying diabetes sucks so prominently here because they feel that's stigmatizing and all kinds of things. And I don't agree with that. And the reason is exactly what you're asking, is that we've had diabetes, you know, you've had it for 48 years. I've had it for 23 years. It does suck sometimes. And there's no sugarcoating that. There's no way around that. There are days when it's rough.
Sugarcoating, that is so good.
Yeah, no pun intended. That was a complete Freudian slip probably. But if anyone tells you that every day with diabetes is easy, they're either blissfully ignorant or they're lying to you. And most likely they're lying to you, because I have rough days. You have rough days. I have met thousands of people in my life with type 1 diabetes. And I don't know one person who's never had a rough day and who wouldn't say that diabetes sucks. But when we sweep it under the rug, when we say it's not that bad, or it could be worse, or it could be cancer, that's one of my least, that just makes me cringe. We're not doing ourselves any favors. One, because we're not being honest with ourselves, but there's more to it than that. We're not honest with ourselves about the real challenges in our life that we have no way of addressing them, no way of figuring out ways to navigate around them, because we're not being truthful about what's going on. In order to solve a situation and deal with things, it has to be in your face and know what you're dealing with. And so you say, you know, I feel like I got hit by a bus because my blood sugar was low yesterday or today, then that gives me something concrete to figure out how to navigate around. If I say, I don't feel that good, but it's not that big a deal, I'm just going to move on, that's not very helpful. So that part of honesty is really important. The other side of it, though, I think is just as important, because so often we make diabetes suck in our minds a lot more than it has to, and a lot more than it actually does. So, you know, I'm going to be dramatic here, but, you know, you have someone who says, I have diabetes and my life is completely over. I'm never going to be able to find the job that I want. I'm never going to be able to find the spouse that I want. You know, it has gotten in my way every step of the way. And I would be willing to, you know, give that there may be some grains of truth to that statement. But I think that we can both agree that that statement is extremely exaggerated, and we can work, you know, clinically to kind of get people back to a place where they're being realistic. But, you know, we get on these mind spirals sometimes where in our minds, diabetes is much more challenging than it actually is. And when we do that, again, we have no way of addressing it. if you have these beliefs and you feel that diabetes is so much more challenging than the reality is telling you that it is, then you have nothing concrete to grab onto to work with. And so we need to bring honesty to ourselves and bring the reality of diabetes, both the fact that it's challenging and also the fact that sometimes we make it more challenging than it has to be, into the lane. When we do that, it's powerful because we can see what's going on in real time, and then we can take actual steps to work with it. And by doing that, it gives us a lot of power. It empowers us to deal with the challenges in front of our face.
Well, I would challenge the thought that it is negative to our community when it says the title, the title is negative to our community. And let me tell you why. Because yes, I'm pretty positive that I'm a positive person. I believe I know that words is a container of power that builds and creates actions, good or bad. Mm-hmm. I believe that in everything you said on the positive side, I am yes and amen to all of that. That sounds like a good country song, doesn't it? Yes and amen. But I know, having been privy to read some of the book early, is that it's not negative. It is just the challenge and the recognition and the honesty of what it is. For my world, right now I'm working diligently with anxiety, and I believe you can reverse it. But if I say reversing anxiety, people that don't follow me enough think that I'm saying we can rid ourselves of anxiety. Mm-hmm. Well, I think that if I'm honest with me enough and can recognize the emotions don't have to dictate where that it takes me, but that I can be the boss of them. Mm-hmm. But unless I recognize that worry, 80% of it doesn't always even happen. And that prolonged worry that leads to anxiety. And we're built to manage stress. We're built to handle stress in an emergency. But here's my example. When I have a low in an airport and my husband's scrambling to find a Reese cup or whatever he can find to put in my mouth, and my brother is laughing at me because all of a sudden I've gotten quiet, and he's used to me, and I've gotten quiet and he's just teasing me because here I stand in a corner waiting to know my name again. The emotions and the draining of all that, be it anger at him or frustration, I wasn't. I mean, it's a true story, but I wasn't. But if I were to be angry at him or frustrated at him, or I would be in a bad mood, I didn't feel good now for a half-hour drive home, after the numbers are normalized, if I understand it all correctly and I will see it for what it is, I can reverse that stress that can't lead to anxiety, because now it's my responsibility, privilege, and obligation to stop that feeling of grumpiness. Mm-hmm. The mood is over, the blood sugar's normal, and we just like carrying on with those emotions that have gotten ahead of us. Now we're frustrated at the way they're driving. Now we're frustrated at whatever. And it's our privilege to turn that around. Mm-hmm. And when I say reversing it, it can be misunderstood. There's opportunities every day to be anxious, but when it goes past an emergency, there's things we can do. That's for another podcast, another day. That's my story, not yours.
Yeah, but I think it's also important to remember the whole title of the book. The title of the book is Diabetes Sucks, and you can handle it.
Absolutely.
And if you're able to see those two things and be able to hold both of those things at the same time, then you're free.
Absolutely. And there's not time, I hope you agree with this, there's not time to explain, oh, I'm not negative, I'm not over here, I'm not saying something, there's not time for that, because the truth is the recognition of what this is, coupled with how to handle it. That was our first talk, because it's in the first of the book. It explains it really in depth. And then we get to this point where it says, why are you ready to take on the leadership role in your life right now? I think it says it like that. I know I wrote it down. I don't know if it's the exact quote. Because you're honest with yourself that it sucks and confident you can handle it. Yes, I wrote that down. Again, you changed a belief, in my opinion, in a few chapters. And now you're leading with action, and that can be sustainable. What more can be said? I mean, there's this book that is going to save tons of money for any individual who wants to get a cup of coffee, sit with a pen and piece of paper, or just a good read. Thank you for that book. Thank you in advance for that book. What else? Now, I've told you everything I like about it. Now, what else would you like to tell someone, if you could only tell them one thing in the book that, like, how we talk about, what would you tell your younger self? What would you tell that newly diagnosed person that they could find in the book as well, but something that will help them?
Yeah. So I think that the one thing that I would tell people is that the biggest part of handling diabetes is recognizing what you have control over, what you have influence over, and what you have no control over. So I tell people, and I'll do this to myself right now. So right now, my blood sugar is actually going high. So my blood sugar right now is 183.
Oh, let's see what mine is.
Yeah, no problem. But 183. And so, right now it's 11:41 a.m. here in San Diego. So I can say that I want my blood sugar to be 158 in 1 hour at 12:41 p.m. Well, I mean, I can try, but the reality is if my blood sugar is 158, that's dumb luck. And so, but we get in this belief that I need to control my blood sugar. We hear that from our doctors all the time: control your blood sugar, control your blood sugar. Well, blood sugar is something that you can't really control. Exactly. You can influence it, but you can't control it. I can say that by 2 p.m., all my blood sugar to be lower than 183. And I think I have a pretty good chance of that happening based on my behavior, but that's influence. That's not control. So, but the same thing holds true for our emotions. I hear people say all the time, I feel burnt out and I want to figure out how not to feel burnt out. And I say, well, once you figure that out, you let me know, we'll make a pill and make millions of dollars. But as far as I know, there's no way for us to snap our fingers or wave a magic wand or take a pill and all of a sudden not feel a certain way. But if we get trapped in the belief that's possible, we keep trying and trying and trying and keep failing and failing and failing. So talk about influence. It can influence our blood sugars, influence our emotions, because we can do things to influence them.
Yes.
They're not completely out of our sphere of influence, but they're not in our range of control. But then you have to ask yourself, what do I have control over? And the only thing that you have control over is yourself and your behavior, what you do. So how you manage your diabetes. Do you check your blood sugar? Do you take insulin? Do you eat? What do you choose to eat? Do you count your carbs? Those are all things that you can control. But also, you can control your behavior with your emotions. You can feel anxious and you can be held hostage to that anxiety. And so say, I'm not going to go ride my bike until my anxiety is gone. Well, that's kind of the common way we think about things. But all of a sudden, you've given all of the control to your anxiety and your fear of lows, or to your burnout, to your frustration with diabetes. And you say, as soon as I don't feel that way, I'll do this thing. Well, all of a sudden, like now the control that you did have is gone. What would happen if you were able to say, I feel burnt out and I can't control that right now. I feel anxious and nothing I can do about it in this moment to make it go away. However, I can still act. I can still do the thing that I want to do. It may not be comfortable. It may be anxiety provoking. However, I can do it. And I want you to lead with action. I want you to allow yourself to dictate your behavior as opposed to allowing your emotions to dictate your behavior. And if you do that, one, you can handle it because that's the definition of handling it. And second of all, now all of a sudden the emotions that you had that were bothering you so much are no longer getting in your way. And therefore, they're no longer as big of a deal as they were before. Because not only did the emotion not feel good, but they were getting in your way of life. And if we took that barrier away from them getting in the way, then all of a sudden they may not feel very good still, but now your life is wide open to you.
That is so good. One of the things when people sit in front of me and tell me how sad they are because of the diagnosis, and it can get to an almost learned helplessness. It can go to far extremes, and I get that, but the feeling is real.
Yeah.
The feeling is real. So I have sometimes said, you cannot want the diabetes, and you can feel that, and you could actually say, now you sit here a minute. Sadness, you sit here a minute. I'm going to go and take this 30-minute walk that I had planned, and I'll come back, and then we'll talk about that again, and look at this number.
Wow.
Now, it's a good number, but what it means to me is, if you'll watch, I'm going down. So I'm going to wrap this up with you while I still know my name. 106 is great, but if I'm going down, I'm not going to stay on here 30 more minutes.
Well, I want you, you're going to be out 83 in 20 minutes, Char. Come on.
It has been such a delight to meet you, first of all, to know that book is coming on the 19th. Amazon, everybody, even I know how to order on Amazon, right? But the biggest thing for us is to leave a review. If we want, I think I want to order some not just to give to patients. I want to order some to give to people that I know that come to me on a casual way, people, friends, family. If we could get them started in understanding and changing those beliefs that you so eloquently and simplistically describe, it can make a difference in how we journey this out with type 1. And type 2s need it too.
Yeah. One last thing I'll say is that I would encourage people, if they buy the book, to buy an extra copy and give it to their spouse, their friend, their mom, or give them the copy after you read it. Because this book is for people with type 1, but it's also for their caregivers, for their healthcare professionals, because the more that we can open people's eyes to the reality of what we live in and the challenges that we do have, the more they can understand it, the more they can support. I tell people, my mother-in-law read the book a couple weeks ago, and she loved it. And it's been so helpful for her to really understand kind of the challenges that I go through. So now I was actually at their house last weekend, and my CGM alarm went off, and she was able to ask me some really good questions about what is that and why is that happening. And I've been married for almost 11 years now. So, she's been hearing these things for a long time, but never asked because she didn't understand. And so the book gave her a basis for understanding my experience and a way for us to connect in a better way.
Well, my husband and son gets that really good now. And they wake me up in the middle of the night, which has been a lifesaver a few times.
Yeah.
But I remember the years when we didn't have that kind of technology. And while I'm thankful for it, my husband was teaching a college class, and I was with a patient across town, and I kept getting this beep from him. He was texting to eat. I had just gotten a monitor, and he was sharing my monitor. He was sharing the information. And long and short of that story is, finally, I excused myself because he started calling. I excused myself from the patient, and I said to him, I'm with a patient, stop calling me. And he said, your sugar. He had dismissed himself from class and gone away to call me. And so now everybody thinks I'm in terrible. I knew that it was going down, and I knew I had eaten something. Whereas I'm sitting here at home in my office, and I don't have a glucotab or anything with me, so I know to get off here. But we are pretty smart. We can figure this out for the most part. So after 11 years and you're not sharing that with all your loved ones, that's yay to you, because I didn't know not to share it, and they were helping me way too much, way too early. Mm-hmm. I guess it takes a type 1 to really get that, right?
Yeah, for sure, for sure.
But thank you so much for joining me today.
Oh, you're so welcome. Thank you very much for having me.
I'm excited to go buy the book, and dare we say there's a podcast that they could also go to.
Yes, called the Diabetes Psychologist podcast. It's available anywhere you get your podcasts, Apple, Spotify, or at the diabetespsychologist.com/podcast.
Do you do your private practice online, or is it strictly face-to-face?
I do both. So I see patients in person in San Diego, and then I can see people anywhere who live anywhere. I can see people anyone who is physically located in California. My license is in California. So, but remember, before you seek therapy, if you need therapy, then great, please be in touch. But if you feel stressed, feel anxious, feel frustrated with diabetes, look at some other options, because there are many other options other than therapy, including this book. And
finally, the website, will that help them navigate learning the different things?
Absolutely. www.thediabetespsychologist.com is the place to find it.
All right. For the pro at podcasting, you have dealt with this old gal really well. Thank you for that. Thank you for joining me, and blessings on that new book and the great reviews you're going to get for it.
Thank you so much.
Bye.